Good time am I on? Right. Oh. Okay, good morning and welcome to the Cook County Health Board meeting on Friday, July 1st. A little bit after 9 a.m., 9:05, and I am the chair of the Cook County Health Board. I'm just serving that role, Raul Garza, and I welcome everyone, the staff and visitors. So with that, I will ask the Madam Secretary to call the roll of the attendance, please.
Director Bott?
Present.
Director Harrington?
Present.
Director Kim? Present. Vice Chair Lowry?
Present.
Director Masuda Barnett? Director Ryder is absent. Director Robinson?
Present.
Director Sorrell?
Present.
Director Stain? Present. And Chair Garza.
Present.
Do you have a quorum?
Thank you, Madam Secretary. The next regular meeting will be Friday, August 28th at 9 a.m. So I know that Director Sorrell is participating remotely. So I'd like to ask for a motion to allow Director Sorrell to remotely participate in this meeting as a voting member. Can I have a motion, please?
So moved.
Second. We have a first and second. Any discussion, comments? Great, hearing none. All those in favor?
Aye.
Aye. Aye. And that motion carries. We'll move down to item 2, which I said repeatedly, the start of 9. Here, part of the agenda on my part, employee recognition. And my favorite person to give that report is Dr. Eric Lefebvre, the CEO of Cook County Health System.
Thank you, Chair Garza. It's my favorite part too. Right. Well, good morning, directors. We're going to start, as always, with announcing our new leadership hires. Welcome to Maria Pestelardo, Compliance Officer, County Care; Silas Fulcher, Director of Supply Chain Management and Logistics; Brittany Provost, Manager, Population Health and Performance Improvement with County Care; Sarah Khalil, HR Onboarding Manager; and Yolanda Penny, Nurse Manager, Registry.
Welcome.
And congratulations to our team members who earned promotions, starting with Seema Gandhi, Medical Director of Digestive and Metabolic Health; Sandra Navarro, Director of Risk Management; and Philip Olanas, Physician Advisor, Medical Administration. Congratulations. We'll share some recognitions and announcements. CCH earned AHA's Get With the Guideline Achievement Awards for demonstrating, and before I dive into this, I got ahead of myself. If you guys are here in the room when I announce your achievements, please stand so we can recognize you. The Achievement Awards, which demonstrate commitment to following up-to-date research-based guidelines for the treatment of heart failure, coronary artery disease, and stroke. Congratulations to everyone who played a role in achieving these recognitions. And congratulations to Dr. Julie Nowinski-Konchak and Dr. Case Powell on receiving the John Nelson Chapel Best Curricula Quality Improvement and Program Abstract Award from AMERSA. They were recognized for their presentation, Integrating Methadone into Primary Care, Improved Access, Improved Outcomes. This award honors innovative programs that advance harm reduction and improve outcomes for people with substance use disorders. Congratulations. And the Journal of Emergency Nursing announced its annual awards recognizing outstanding research and reviewers, and CCH brought one of those awards home, the 2025 Clinical Paper of the Year, entitled Optimizing Administration and Timing of Post-Intubation Analgesia and Sedation in the Emergency Department. Congratulations to Dr. Needleman, Dr. Dyer, Dr. Martinez, and Dr. Ritsulius. And congratulations to our CIRMAC Chief Nursing Officer, Nuri Marcello, who received the 2026 NCCHC Edward A. Harrison Award of Excellence in Correctional Healthcare Leadership, reflecting her exceptional leadership and the CIRMAC team's ongoing commitment to innovation, collaboration, and excellence in correctional healthcare. Congratulations, Nuri. And congratulations to Dr. Kiran Joshi, who was appointed to the Board of Directors of the National Association of County and City Health Officials, which is the voice of over 3,300 local health departments across the country. Congratulations, Kiran. Yeah. And congratulations to our Good Catch winner for the month of May, Valerie Dunn Adams, Pharmacy Technician at Providence, for keeping our patients and our team safe. And congratulations to Stroger nurse Abby Thomas, Surgical ICU, for becoming a DAISY Award honoree. The DAISY Award is a recognition program to celebrate and recognize nurses by collecting nominations from patients, families, and coworkers. Congratulations, Abby. And congratulations to Claudia Birchnell, Executive Director, Ambulatory Services, Nick Shields, Chief External Affairs Officer, and Adam Weber, Executive Director of Operations, for being selected for the America's Essential Hospitals Fellowship Program. For more than 30 years, the AAH Fellows Initiative has been a highly sought-after leadership program dedicated to educating educating participants on issues that impact essential hospitals. Congratulations. And our communication and marketing team was recognized with several awards this month. The Astor Gold Award for Multilingual Advertising, Total Advertising Campaign County Care Rewards You, and the website countycare.com. And they received an Astor Silver Award for Total Advertising Campaigns Fight the Bite for our Cook County Department of Public Health. Congratulations. And earlier this month, a group of students from Health Career Connection came in for a tour, a panel discussion with Dr. Lauren Smith, Nick Shields, Tracy Everett, Imani Harris, Joe Price, and Jasmine Sanchez. And they had a simulation experience with Dr. Ashley Winfield. And through the Health Career Connection program, college students are provided opportunities to gain invaluable insight on healthcare career paths, role models, and operations, as well as mentoring, and to make a difference in their organization and their local communities. Congratulations and thank you. And our bike commuter challenge, here, teachers solidarity. It was a month-long biking competition where Chicagoland organizations compete to see who can earn the most points by riding their bike for work-related trips. The CCH 2026 team of 42 riders came in first among public agencies with more than 5,000 employees. And fifth among all of the 90 participating teams. And we had participation from across the health system, including here at Central Campus with Stroger County Care in the Professional Building, Quabbin Hospital, the Cook County Department of Public Health, CIRMAC, and ACHN. Please reach out to Kathy Chan or Andrea Gibson if you want to join next year's team. The summer of 2027. Kathy, Andrea, if our board members ride their bikes to board meetings, does that count? Yes? Okay. All right. And I'll close with a word of thanks to all of our staff who represented our commitment to health equity at this year's Pride Parade last month. Thank you.
Okay, now I think you can hear me a little better. It's always nice when we take a bit of time to go through that because it reflects great people accomplishing great things, both at the county and the communities.
Absolutely, yeah.
So thank you, Dr.
Favorite thing, and before I hand it back to you, I think we're going to add Andrea's section of the update strategy planning and ARPA to the end of this section of the report. Andrea, can you? Okay. And then we won't have a second.
Okay, sounds good.
Good morning, everyone.
Good morning.
Andrea Gibson, Chief Strategy Officer. First up, our usual review of different initiatives that are either accomplished or coming soon. I'll highlight a few of them. Under quality, wanted to share that CCDPH received an award for the 2026 Making a Difference campaign related to reducing tobacco use, preventing youth nicotine addiction, protecting people from secondhand smoke, and providing cessation resources. They also launched an anti-vaping campaign for youth and young adults at the end of June. Under workforce, we welcomed 133 residents and fellows on July 1 and improved our administrative onboarding process to make it a smoother start date. We've also made progress on the revenue cycle insourcing positions, and we'll continue to be working on that. Under transformation and growth, we launched a telehealth clinic for endocrinology and diabetes for CIRMAC patients. And something that we're working on, targeting September, is delivering an MRI scanner and trailer to Providence. Under fiscal resilience, we've talked in this forum before about texting Aetna members who have upcoming redetermination dates. We've been able to work with Blue Cross and Blue Shield and Meridian to extend that to them. And so we're connecting more with those patients with upcoming redetermination dates and hopefully connecting them to the information they need to keep their coverage. Next slide, or should I, any questions on this? Next slide is ARPA. So we're in the home stretch of ARPA, and we have about 36 million left to spend. As a reminder, the work is really happening right now in August and September with all of the subrecipients. The work needs to be complete by September 30th. We'll be processing invoices through the end of December, and we are on track for expending these dollars. Any questions?
Any questions from the board?
So all the money will be extended by the 30th of September?
No. All of the money will be spent by the end of December, but the work for the subrecipients has to conclude by September 30th. Then we'll be processing invoices.
Okay, thank you. Any other questions? Thank you, Andrea.
All right.
Appreciate your update. Okay, we'll move to item 3 on the agenda. Madam Secretary, are there any speakers registered to provide virtual or in-person testimony, or has anyone sent written testimony in to be included into the record?
We did not receive any written testimony, but we do have 2 registered speakers. The first speaker is Nicholas Fernando, and the second is Khadijah Sharif. And as a reminder, you have 3 minutes. I'll remind you when 2 minutes have elapsed and when your time has elapsed.
Hello.
Good morning.
Good morning. Cook County Board of Directors. I am Nicholas Fernando. I am a Storter Cath Lab nurse and an NNLC member. I'm here today to speak about the ongoing issue of mandatory overtime in the cardiac cath lab and the serious impact it is having on our staff, patient care, and the long-term stability of our department. Our department operates on 1 shift. We don't have additional staff to relieve us at the end of our scheduled shift. If cases are ongoing, we are forced to finish them. This leads us to our problem, mandatory overtime. Over the last few years, our nurses have transitioned from 8-hour shifts to 10-hour shifts to provide expanded procedure hours. The problem with this is that our assigned day off was not accounted for in our staffing plan. Currently, with vacations and leave, we're down to 5 procedural RNs to staff our unit. In addition to our staffing shortages, cath lab nurses are on call for emergencies. Over the last few years, our department has had multiple services added, such as our expanded electrophysiology, our structural heart program, and our pulmonary embolism response team. These all are performed within the same lab space with the same resources. Despite these increased demands, we are still with only 7 total cath lab nurses, with even less during our work days due to that off day. There has been no meaningful increase in staffing to support the expanded schedule or the growing workload. Instead, mandatory overtime has become the solution to an ongoing staffing problem rather than an emergency measure. We are provided almost daily with flow pool staff. They work 12-hour shifts and eat up some of the hidden hours that our cath lab staff would be occupying. If not for them, we would be having even more mandatory overtime. Flow pool staff have become upper management's response to our predicament. The cath lab is not an area where any available body can simply fill the vacancy. These concerns are significant given the county's substantial investment in our cath lab. Our services are ever expanding, and it is a disservice to our patients that we do not have enough sufficiently trained staff available to safely and competently perform these procedures. Without adequate staffing, that investment cannot achieve its intended purpose. Our staff have not remained silent. Over 20 grievances in the last 18 months have been filed regarding these working conditions, and many have been sustained. Those outcomes demonstrate that staff concerns are legitimate and supported by the contractual process. Our staff participated in mediation with the county PHR and came prepared with reasonable proposals aimed at improving staffing and resources.
1 minute remaining.
Instead of meaningful discussion, those proposals were dismissed and staff were characterized as being unreasonable. Perhaps the most frustrating aspect is that management and administration at multiple levels have acknowledged that there is a problem. We continue to hear that everyone agrees mandatory overtime is unsustainable,
Yet responsibility is consistently redirected to County BHR as the reason nothing changes. We're asking the Board of Directors to provide meaningful oversight and ensure that sustainable staffing solutions are implemented. Our nurses have demonstrated flexibility, professionalism, and a willingness to collaborate. We have changed our schedules, carried the burden of around-the-clock call coverage, and participated in mediation and pursued every avenue available to resolve this issue. We are simply asking for the staffing support necessary to safely care for our patients. Thank you.
Thank you, Mr. Fernando.
Okay, the next speaker is Khadijah Sharif. I don't believe she's present. She is registered for the finance meeting, so maybe she mistakenly registered for both.
Okay,
Second, please.
so we will move on. And the board item, excuse me, item 4 on the agenda will be a closed meeting item. And the board will be going into closed session. Before I do that, let me recognize Director Rob Ryder into the record. Welcome and good morning. The board will resume consideration of the items on the agenda when it returns in the open meeting. So I will ask at this point for a motion to go into closed meeting pursuant to the following exceptions to the Open Meetings Act, 5 ILCS 120/2 C 1 to 11, 12, 17, and 29. And we will need a roll call vote for this item. Can I have a motion, please?
So moved.
Thank you. And I have a first and a second. Is there any discussion or comments? Hearing none, I'll pass it over to Madam Secretary to take the roll.
Roll call vote on the motion to go into closed session. Aye or nay? Director Bob?
Aye.
Director Harrington?
Aye.
Director Kim? Aye. Vice Chair Lowry?
Aye.
Director Masuda Barnett? Aye. Oh. Director Ryder?
Aye.
Director Robinson?
Aye.
Director Sorrell?
Aye.
Director Staines? Aye. And Chair Gardner?
Aye.
That's 10 yeas and 0 absent.
Okay, thank you.
So we will go into closed session.
So we will go.